others. So this year in particular, given the pandemic situation, we are strongly recommending limiting crowds as much as possible. In crowds, COVID-19 spreads quickly, and by keeping our circles small, we can limit the virus's ability to spread. So what does that mean? At home, that means sticking to your friendship circle of 5 people. You can have 5 non-household people over, up to a maximum of 10 people in total in the house. So if you live with 2 people, you can have 7 people indoors. If you live with 6, you can have 10 people in total. It is best if these are the same people you choose to spend time with. The more faces we see, the wider the network of transmission. And the wider the network, the more difficult it is to contain outbreaks. In businesses like bars and restaurants, it means following all the rules the facilities have in place to limit crowd sizes, to encourage physical distance, and to comply with enhanced cleaning. And for business owners, we want to renew our call to update your exposure control plans, to encourage more distancing, lower capacity, and more masking, especially in the hospitality settings. I also want to take this time to thank businesses that take these precautions seriously for their efforts. You are helping keeping our communities safe. These steps are crucial because across the country, countless outbreaks are connected to home-based gatherings and gatherings at bars and restaurants. And we know it is tough to hear these calls to continue to alter how we live, even as we head towards the season of celebration. Pandemic fatigue is very real. But for the first time since the pandemic began, we have glimpses of light at the end of this long, dark tunnel. But right now, we have a choice to make. We can give in to the fatigue and risk the sacrifices we made so far to keep our territory strong. Or we can commit ourselves to the healthy habits we know work, and together we can stop COVID-19 in its tracks. We can all do our part to protect our friends, our families, and our elders. And as we get closer to approved vaccines which will save lives, we're one day that much closer to normal. So if we do want to keep moving down the road to recovery, we need to stick to these healthy habits. Keep 6 feet apart at all times. Wear a mask when in indoor spaces or when you cannot maintain your distance. Keep crowds small and spaces large. Keep coughs and sneezes to ourselves. Wash your hands frequently. And stay home even if you're a little bit sick. Call your health center to be assessed for COVID-19. And self-isolate when required, alongside those who live with you, and self-isolate whenever required alongside those you live with or at a different location if you cannot isolate with your family members. Together we can keep our territory strong and healthy as we prepare as a country to end this pandemic. Thank you to everyone for following the rules, and I hope to see everyone continue to support and care for each other through this holiday season. And thank you, media, for sharing the story.
Thank you, Dr. Kandola. We'll now open up the floor to questions, and we'll start with Charlotte, APTN. One question, one follow-up per reporter as per normal procedure. Go ahead, Charlotte.
So this question, Charlotte, for PCN, is directed to whoever would like to speak. Is there an estimate on how much cost-reducing measures, such as having non-essential travel paid for at their own expense, does the government know how much that will reduce costs of isolation centers?
Thank you. It's a little bit premature to identify what exactly the cost figure will be. What I can say is that a substantial amount of the isolation that is paid for by the governments of the Northwest Territories is around leisure travel, and mostly in our hubs. So mostly in the Yellowknife area is the highest being utilized for isolation, Nunavut, K River, and Fort Smith as well. So I think that we are expecting, and that's why we made the orders effective January 5th. We don't want to penalize people. We're really hoping that people will choose to do the thing that it's tough, the right thing though, and to avoid non-essential travel. But those who have made arrangements, those who are having their children come up and their family members, we want to accommodate them as well. So that's why it started on January 5th. I think that within approximately 3 months from then, we'll be able to make a more valid assessment of how much money this is actually saving. The big thing is, I mean, we have one thing that says save money. That's a taxpayer. We have a responsibility to be accountable. The bigger thing is that we really want to emphasize it's not the time to travel. I know we're all tired. I know that mental health is hard, and we have loved ones in the South, but the risk is so high, and we don't have the capacity to care for it. So that is the most important factor in determining the stopping for the leisure travel. Thank you.
A follow-up for Premier, messages like that. I'm wondering, in your opinion, how are these new measures being introduced equitable for communities that are outside of the hubs? You mentioned that Yellowknife has some of the highest rates of people traveling for recreation. In your opinion, how are these new measures going to be equitable for smaller communities?
We're trying to make the measures as equitable as possible. None of the measures that we take are about everyone's freedom, being able to do whatever they want. I mean, that's the norm. That's what we want to get back to. But these measures are about saving lives, about doing what's right for people. So right now, I mean, if anyone in the territories has the ability to self-isolate, the hubs, the small communities are the most at risk. They are the ones that don't have the health centers, the capacity, and our bigger centers don't have the capacity for very much as well. So there is a clause within it that has exceptional considerations. So if there are people that, like I said, if you're going south for a funeral, a family member is ill, we're not trying to penalize people. We will pay the isolation costs for that. But we're begging everyone. In Yellowknife, we're not paying for it, so it is equitable. We're not paying for your isolation in Yellowknife, or from Yellowknife residents, or Nunavut residents, or Hay River residents, or Lutz K residents. Anyone who wants to travel for leisure after January 5th, we will not be covering their costs for isolation unless there's an exceptional situation. So I think that's about as equitable as we can be, because everyone will be under the same policy. Thank you.
Thank you. I'd like to just remind reporters, if you don't mind, just remove your mask and step away from the person next to you when you're asking your questions, so our speakers can hear you nice and clear. So Luke, CKLE, will go to you next.
I'm not sure who this is for, but it's just kind of some clarity on these new restrictions. So if somebody is self-isolating at a self-isolation center until, let's say, January 7th, do they have it paid for until January 5th, and then they have to pay the last 2 days? How it works?
Thank you. Actually, that's a valid question. I was kind of asking the same thing myself when we were making the policies. No. The answer is that if you've come in, if you arrived in the Northwest Territories on January 4th, you will be accommodated. If you fit, we will still provide for your self-isolation. If you're arriving in the Northwest Territories on or after January 5th, at that point, you have to make your own arrangements for self-isolation and pay for the costs. So like I said, anyone that coming in before January 5th will be covered. Thank you.
Follow-up, Luke?
Yeah, I guess I'm just wondering, is there any concern with these higher restrictions that there is going to be more people breaking self-isolation protocols? Is that kind of a worry from you guys at all?
I'd love to be able to stand here and say no. I'd love to be able to stand here and say that every single resident takes COVID-19 seriously. But I mean, you're the media, you see the comments on your own pages. Not everyone takes COVID-19 seriously. Not everybody believes it's real. Some think it's a conspiracy. So there will be a risk that people will break isolation, as there's been a risk already. And that's why we have the enforcement team. If we find out, so it's two sides. Please, everyone, do your part. to protect. It's not only about you and your loved ones, it's about community members. It's about our elders. It's about our knowledge keepers in the north. It's about keeping people safe. We don't have the capacity to take care. If we have a huge outbreak, we can't take care of everyone. So everyone has a responsibility to take care. And on the other side, if you see people, again, our enforcement is there to try to make people abide by the orders, but we don't have enough enforcement officers that we can put one person on every single resident. So on the other side, I'm begging residents, if you see people that are breaking the orders or that you suspect, please call 811 or Protect NWT. We may not get back to you and tell you that we charged someone, but I can assure you that every single call is being investigated, and that is the only protection, that's the best protection we can do. Thank you.
Let's turn now to Hillary at CPC.
I think my question might be for either Minister Green or Dr. Kandola. We've heard some concerns about people who have come up and are doing self-isolation and are told that they'll be checked in with and then are not checked in with throughout their whole self-isolation. I heard Minister Green mention some changes to that, and I'm wondering if you could clarify that a bit.
What was the question?
Changes to the check-in during self-isolation.
Yeah, I can tell you about the check-in. So what's going to happen now, instead of having emails go to people who are in self-isolation, there will be phone calls that will function as a wellness check, ask people how they're doing, make sure that they're doing okay, remind them about the terms and conditions of self-isolation and so on, and that's supposed to start within the next 2 weeks.
And that, yeah, sure, that's throughout the territory. For people with self-isolation.
Wherever people are self-isolated, yeah.
Okay, perfect. Let's go Natalie and NSL.
I think this is a question for Premier Cochrane. I am just wondering if you could expand a little bit on those 19 tenders that went out on the isolation center services. I'm not sure I'm clear on what that is about.
Thank you. So within the governments of the Northwest Territories, we try to be as fair as possible. When COVID-19 hit, our economy took a hit as well, and businesses are hurting. So my understanding is right now the government of the Northwest Territories is one of the biggest contractors out there. So our goal is to try to help as many businesses as possible to make it through the pandemic so that they can continue to provide the services they provide to our residents as well. When it first hit, though, we had to scramble. So we contacted whoever we could call, and we just made arrangements to get hotels and to get meals done. Now that we've had a little bit of time to think back, and now that we've worked with the Business Advisory Council and heard the business community, the right way is we have the time. So now we're putting it out to tender. We're putting out to tender for places for isolations, not only hotels. People have bed and breakfasts that might want to offer those services. We've gotten emails from people saying, I want to offer my bed and breakfast now. I need business as well. So the rooms will be out to tender. The food that's supplied will be put out to tender. Security. We've had a lot of calls and people saying, people are checking into the isolation centers and they're partying. So I hate to say that we have to put security in, but now we have to put security in. So all those things will be tendered because that is the right way to be able to spread the money around and to be able to give every business a chance to be able to get a contract. Thank you.
Follow up?
Just again to clarify, for those facilities, that's something that the government would continue to pay for, again, until January 5th, and then those facilities would continue to be available to isolators after that, is that correct?
Yes, we're not stopping the isolation costs for all people. We're stopping the isolation, paying the fees for people that are traveling for leisure. People that are going for holidays will no longer be covered. But we will continue to pay for people that are on medical leave, people that might have tested are waiting to get results from a test. If the CPHO says that they need to be self-isolated, we will accommodate those people. People that have special situations, never know what they may be, we'll cover as long as it makes sense. And of course, people compassionate, people who lose people or have loved ones in the south that are not doing well, we'll cover those as well. Again, it's about just stopping the covering for the leisure travel. We're trying to do our best to be able to protect the territories, and hopefully people will not travel unless it's essential, although we recognize it's tough. But as Dr. Kandola said, the light is at the end of the tunnel. So we're used to staying in the winter, a lot of us. Let's try to stay in, keep our bubbles small until the spring comes, and hopefully we'll begin the vaccinations. Thank you.
Let's turn now to Bailey Museka.
Hi, this is a question for Premier Cochrane. So the leisure travelers who are coming back, I think this is kind of what Natalie was asking. Will they still be able to isolate in the isolation centers and just pay the cost, or will they have to find somewhere else to isolate?
Yeah, so again, leisure travels will be accommodated until January 5th so that we don't wreck anybody's holidays that have already been pre-planned and pre-booked. After that time, they will be responsible for making their own arrangements. So hopefully people will make arrangements before they leave the Northwest Territories, would be the word of advice. Again, if they can isolate in the hubs, in their homes, if they have the separation as per the order, then that would be fine. But other than that, they will have to be looking at, I mean, right now we're renting from hotels. That's where our isolation centers are. So, and the isolation centers, the hotels are not only people in isolation, there's people that are traveling. So I'm assuming that people would be able to use those services just as well. If people do have a trouble finding out, get a hold of us. We will give a list of all of the accommodations available in the NWT or in that area that they might need to. But I think most people are pretty aware of the hotels and the bed and breakfasts or whatever in their communities. Thank you.
Yeah, I think this is for the Premier's last, right? I know you said it's too early to say how much the cost savings would be, but do you know what the next priority would be for the money that would be saved, for the money to go towards, maybe especially within the COVID Secretariat, since so much of this money is going towards the isolation centers? What's the next thing that the money will be going towards, or will it just be kind of kept in pocket?
Well, I do want to give a huge thank you to the federal government. People that were watching the last sitting of the Legislative Assembly, we had estimated that $31 million would be needed to provide the Secretariat fees to the end of this fiscal year. The federal government came out and gave us $30.7 million. So that's huge for us. They also gave us monies before that. So it does give us a little bit of leeway with that. We will be looking at all of the COVID-19 responses, not just the Secretariat. There's other expenses that we've taken on, lots of expenses, from health to economic supports to family supports. So we will probably be trying to utilize that money. Our priority right now is health, the health and safety of people. So if it's not needed for the Secretariat, although we haven't sat down and have those discussions, my guess is that health would be the next priority to make sure that we have the facilities.
Megan, you have her.
Yeah, sorry, back up here. I believe this would be for the Premier. So I know when Charlotte asked, you said that you are being as equitable as possible and that you're not paying for anybody, but isn't it at least not a little bit discriminatory if people in the isolation centers can go down south or travel and come back and self-isolate at much lower cost than people from smaller communities could frequently?
There's always a cost factor within the Northwest Territories. So it's, like I said, we're trying to be as fair as possible. I think the issue of equity comes more about are we paying for some people and not for other people? We're not paying for anyone after January 5th for leisure travel right across the NWT. As for the cost of isolations or the cost of travel, those are not new to COVID-19. Those costs have been there since before COVID-19. So, you know, that is the cost of living in the North. We try to accommodate in various other ways, rent subsidies, power subsidies, food subsidies. We don't get all those benefits in the South. So is that equitable? So again, it's about COVID-19 has made life not very equitable. All the freedoms that we're used to having, we've had to sacrifice. So we're doing the best we can. But equity, being equal across, is something that is bigger than COVID-19.
Follow-up question?
Yeah, so I know obviously circumstances? What might an unforeseen circumstance be?
I'd hate to guess what an unforeseen circumstance would be. Well, it's like if somebody goes down south and has isolation planned, and then something horrible happens in their life, and then they don't have the finances to come back and isolate. That's an unforeseen situation. For certain, I would support that. So again, it says unforeseen because we don't know what they are. But it's preparing for those people that we love to have life as a plan, and especially, this is what I'm going to be, and this is where I'm going to go, and this is what I'm going to do. But things change. So we're just preparing to make sure that we accommodate for people if their situations don't allow them to be able to isolate.
All right, and to finish us off, Nadia Tega.
I think my question is for Ms. Muir.
You get lots of exercise.
So, really related to the traveling, a lot of people by now have made their plans, and now they're being told they have to come back the 4th of January. So, what made you take the decision on the 4th of January? And don't you think this is a little short notice, some people might say?
Well, I would say that the pandemic itself was pretty short notice. We got hit off guard with it, and so there was no notice. When the cabinet decided to do this, we tried to give as much notice as possible. Again, as soon as we got through the last sitting, the Legislative Assembly, we got fight from some MLAs, not all. We got through. Some MLAs were at that time saying no secretariat, period. Some MLAs were saying bring down the cost, you can't afford it. So we made a commitment in the House that we'd be looking at the cost factors. And again, like I said, consultation is important. We went to the business community, the Indigenous governments, the municipal governments, and the MLAs, and said, what do you want? What do you think is fair? So it was compiled of all their voices that said we shouldn't be paying for people to travel. We can't afford it. We're a small territory. We don't have the money. And is it fair that people are allowed to travel to go on a holiday and then they come back and they get paid from the GNWT? I'm not going to argue if it's fair or not, but what I can say is we're not promoting people to leave unless it's essential. But we did want to be compassionate. So instead of saying that this policy starts now, which we could have done, we did a factor and we said most people that travel for holidays, they tend to go down, they spend the Christmas, they spend the New Year's, and then they come back. Usually work starts, school starts, I think around the 4th of January. So that was the defining factor, is when the majority of people would be back to the Northwest Territories. At that point, then, if people decided to stay longer, then they would have to make arrangements. Thank you.
Maybe really just a detail. I'm not sure if it's only in the French release. For family reasons, here it's written Vancouver and Toronto. Is it limited to Vancouver and Toronto?
No, so I apologize. It might have been the translation. It's anywhere outside of the Northwest Territories. Thank you.
All right, that brings us to the end of our press conference this afternoon. I'd like to thank all media for attending and spreading that message. It's really important that we get that out there. You have the news release and a detailed background are with you. There's a contact in there for any media contacts specific to this. So please feel free to contact Mike for those, or of course you can always email presssecretary@gov.nt.ca. We can get you some comments from either Mr. Green or Premier Cochrane. So again, thank you to everyone for coming. Thank you, Premier Cochrane, Mr. Green, and Dr. Kandola, and everyone have a great afternoon.
Thank you, everyone.